Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. So postpartum depression, a big one. And I am here with Dr. Adryon Burton Denmark. Would you go ahead and introduce yourself?
Sure. And you can call me Adryon if you want. I am a practicing psychologist here in Salt Lake City, Utah, and I focus primarily on anxiety and depression in adults and teenagers. I also have a focus on working with parents in my practice. So I do perinatal mental health, and I have, pre-COVID, I was running for many years mindfulness-based groups for parents specifically, focusing on cultivating self-compassion.
Okay, great. So let's jump right in and talk. What is postpartum depression exactly? What is it and what causes it?
Right. So we thought we'd start with some symptoms of postpartum depression: feeling worthless, helpless, guilty, hopeless, irritable, crying a lot more than usual, loss of energy, appetite changes. I think the big one is going to be trouble sleeping. So some sort of sleep disruption. And then in some cases, thoughts about hurting yourself or hurting your baby. And we'll talk more about that later, because that can certainly be one of the more distressing symptoms.
Yes.
And that is one of the symptoms that is certainly different than, say, the typical baby blues that I think probably many, many new mothers have. So those are some of the symptoms. And I think it's important also to talk about some risk factors. And so any new mother certainly can experience that postpartum depression. But if you have a history of depression, either during the pregnancy or, even not during the pregnancy, that's a risk factor. If you've been diagnosed with bipolar disorder, if you've had previous pregnancies with postpartum depression, or family members, if your baby has health issues, and interestingly, if you have twins, triplets, or other multiple births, then that becomes a risk factor. And then there are also factors within the relationship. If you're there with the child's father, like a weak support system or financial problems, you just have this added stress. And I think later, or maybe even right now, Adryon can talk about the effects of COVID, because we've been in a year of, a lot of stress for a lot of people, including financial stress, health stress, and that makes things a lot harder. So what's your experience with
Exactly.
that?
Yeah. So I think before getting to that specifically, talking a little bit more about baby blues, and statistics I've seen are about 85% of new birthing moms experience this. And it has a lot to do with physiology. It has a lot to do with the fact that your levels of progesterone and estrogen are very, very high right before you give birth.
Right.
They drop dramatically afterwards. There's also the effect of prolactin as you would begin producing milk. All of these intense hormonal changes conspire to make most birthing mothers have intense mood swings in the first 2 weeks. So a lot of weepiness, disruption in sleep, increased anxiety, increased feelings of sadness. But the normal baby blues that are so physiologically based, and we really are talking about moms giving birth, or parents who give birth, I should say, that tends to go away. After about 2 weeks, by about 4 weeks, for most people, those symptoms have remitted. And that's one of the ways to begin differentiating. Is this typical baby blues, or is this postpartum depression, which, as Mark was detailing, has many other contributing factors.
Right. Yeah.
And so
I was going to say one of the reasons why I wanted to do this episode early on in this podcast, is because this hits very close to home for me. When my first daughter was born, I had normal baby blues, the weepiness, the mood swings, but after about 6 weeks, it didn't get better. And one of the most frightening things, and we'll touch more on this later, one of the most frightening things for me was thoughts of being angry and thoughts of even hurting my baby. And in my mind, I'm like, I'm not a bad mom. I would never do that. But you can't help these thoughts, these very intrusive thoughts. And it makes you feel isolated. It makes you feel unfit and unworthy to be a mother. And it's not true. You're not a bad mother for these thoughts. And it's something that I feel very, very passionately about and very strongly about destigmatizing postpartum depression, because women and anyone who's going through it, they need help. They need support.
Exactly. And in fact, social support is one of those crucial factors in helping bolster against postpartum depression, in the treatment of it. And so, one of the things I was looking at, just their best estimates of how the year of isolation from the pandemic has changed this, is that rates of prevalence have gone from about, 15% of women having been diagnosed with postpartum depression pre-pandemic to about 36%.
Wow.
Yeah, so tripling, which actually mirrors the fact that depression in the population has tripled during the pandemic.
Yeah, that makes a lot of sense. Depression and anxiety have gone up so much.
Right.
Yeah. Well, we as human beings, we're not meant to be isolated. We're naturally social creatures, and we crave people.
And we especially need that support system in transitioning to parenthood, whether that's transitioning to being first-time parents or, adding another child to the family. And so that's why I wanted to mention that, the baby blues is a very physical thing that affects, birthing parents. Postpartum depression or mood disorders like postpartum anxiety or OCD, they really affect adoptive parents. Fathers and non-birthing mothers are also affected by this, and they may be even less likely to seek support because, this label postpartum depression seems to imply that it just has to do with the woman who gave birth.
Yeah.
However, all these other factors, marital stress, low social support, the expectations you might have for yourself as a parent, and the terrible, terrible sleep deprivation.
I agree with that. And I actually have a client that I've seen a long time, and they just had their first child. And he has this is the man, he has some underlying anxiety and a little bit of OCD, but when the baby was born, it just exploded. And so it becomes you're trying to do your best job you can as a couple to raise this child, the first time baby. But then if you have this extreme anxiety and this obsessive compulsive piece to it, it's really, really difficult.
Yeah. And the hard thing with anxiety and depression is people say, well, it's all in your head, which is true. But just because it's all in your head doesn't mean it's not real, and doesn't mean it can't manifest as physical symptoms. And it doesn't mean it's not crippling.
Yeah, it is definitely not all in your head.
Yeah.
Right? It's very
they're physiological. It's very physiological.
Yeah. I mean, it's happening in your brain mainly, but I mean, your brain is the control center. Yeah, the brain is the control center of your body. So if your brain is not functioning right, how in the world is the rest of your body going to function properly?
I wonder if that leads us into talking about sleep.
Yes.
Before we got on with you, Adryon and I were talking about, if you could say, just get sleep, that would solve a lot of issues. But that's true for, people who are dealing with the depression and anxiety. There's always a component of some sort of sleep disruption, but it's probably the hardest thing to do. I remember with my 4 kids, that first year was my least favorite year because of that, because the sleep disruption. And that's why I wanted Adryon to come in and talk about it. And you're talking about having kids. I didn't have the children.
Right.
I was there and I witnessed it, but I can't imagine how difficult that is, how hard it is for new mothers to be so sleep deprived.
Yeah. And I think male spouses, or, whoever is not primarily taking care of the baby can experience sleep deprivation too, because it interrupts their sleep. I mean, they may not have to get up. They may not be the ones always getting up with the baby, but your sleep is still interrupted. I know at one point with after my third baby, he was a really, really bad sleeper. And we ended up sleeping in separate rooms because one of us had to be functional. And I could kind of get naps throughout the day. So I said, okay, you go sleep in another room, get your sleep so you can function, do your work, do your job, and I'll take care of the baby. And you let me nap when you can, and we'll be good. And I think with postpartum depression, you have to have some sort of support. And as a couple, you need compassion, you need understanding, and you need a plan to get sleep.
Mm-hmm. And recognizing that for many people, it just may not be possible. People who are single parents, for example.
Yes.
If they can't afford the services of a night doula, that could be very helpful. Mm-hmm. Calling on family, calling on friends, activating their support network as a way, not just for emotional support, but really as a way to like have someone take the baby and you can take a nap. All of that is really important. And many people are in a position where they just do not have access to that.
Which has got to be terrifying and devastating.
I think that's what's happened during the last year with the COVID and the quarantine and isolating is even though you might have those resources, I think a lot of older, say grandparents, have been really reluctant to leave their little cocoon of safety.
Yeah.
And so then,
understandably.
So, I mean, then what do you do?
So, So a huge thing is to have compassion for yourself. I want to acknowledge a few other contributing factors, risk factors that we didn't mention, but they definitely show up in the research. Having a harder temperament baby.
Yes.
My first had terrible acid reflux and also temperamentally is a very bad sleeper. And when you have a child like that, even if all other things are held equal, you are more vulnerable to depression because you are not sleeping as well.
Yeah.
So compassion for yourself. It's hard. One of the ways I try to talk to people about compassion is to imagine what you would say to your best friend if they were going through the same situation. Usually the things we would say to a friend are really different than what we say to ourselves. To a friend, we say things like, oh, you're going through such a hard time. I'm here for you. I care about you. I believe in you. You're doing the best you can. These are all the things that we need partners to say, if you have a partner, to say this to each other, build each other up this way, but also to say to yourself, because the ways we tend to talk to ourselves are far more critical. You mentioned feeling like a bad mom, certainly this narrative, I'm a bad parent, is another huge risk factor for developing postpartum depression.
And I think even if you just tell yourself, I'm here, I'm here and I'm doing it. I think just the fact that you are being there is enough. And newborns needs, and they're relatively simple. And it's this huge, huge deal to become a first-time parent. I remember feeling so overwhelmed and so stressed with my first. And then I had my second baby, and in the newborn phase, I'm like, why was this so hard? But it really was, and it felt so overwhelming. But I was there, and I did it, and she's still alive, so I did something right.
That's right, you did.
And in fact, that is another piece of advice for all parents is, reducing their expectations of themselves. That idea, like if you made it through the day alive, if your baby made it through the day alive, that is enough. And, the house does not need to be clean. I might almost say it shouldn't be, right? that all other expectations can be set aside. This is going to be a survival period for a while. And so, one of the things I think you had a note about, like talking about how long it tends to last.
Yes. Yes.
Certainly, it is really important at the point where the parent themselves or someone else in their circle notices that this mood disruption, this anxiety, or this pervasive sadness, or this pervasive lack of interest in things is lasting longer than the baby blues period. It's present at 6 weeks. Maybe it's even getting worse. After 6 weeks, a lot of infants will begin to sleep a little bit more. And yet if you're getting more sleep and, the mood symptoms are the same or worsening, it's definitely important to seek help. And at any point, if you have thoughts about hurting yourself or your baby, it's important to seek help.
And I think another thing to touch on too, and I know we hear this before, but I don't think we can say it enough. It's okay to put your baby down. It's okay if your baby is just screaming and you feel so overwhelmed and you feel like you can't cope with it. It's okay to put the baby down in their bed where they're safe and walk away for a minute or two and recollect yourself. I don't think that can be said too much, that right. It's okay to do that.
I'd like to give a resource as well. Now, this is going to be resource specific to Salt Lake City, but I'm guessing that in other metropolitan areas, you'll have a similar resource. So in Salt Lake, it's called the Family Support Center. And what they have, they call it a crisis nursery. Okay. And when I was associated with them years ago, they had 2, one in Sugar House and one out in Midvale. I believe they have 3. But what you can do is if you feel like you can't take care of the child or that you might harm them, then you have a place where you can go. They will take care of the child, no questions asked. You have up to 72 hours. And then you go, and then when you're feeling calmer and better able to parent the child, then you go pick the child up again. And they're really, it's like a home environment, just so you know. So they always have 2 parents there, and there's a staff, and it's a really great service. So I would guess in other metropolitan areas they have that as well.
I will get that posted in our show notes so that people can find access to that.
And so two other resources, regardless of where you're located, definitely the Suicide Prevention Lifeline. If you are having serious thoughts about hurting yourself or hurting your baby, you can call 1-800-273-TALK.
Okay.
And then there's also the Postpartum Support International Warm Line, is how you'd consider that.
Okay.
So that number is 800-944-4PPD.
4PPD?
Yeah, 4773.
Okay.
And that is staffed by moms who have experienced depression and anxiety, who have also received training. It's free and confidential. It's just not necessarily a 24-hour crisis line. And so you can leave a message and you'll receive a call back within about 24 hours.
Okay.
So you may reach someone live when you call, and you may not. Okay.
Yeah, that's a good resource. I think oftentimes just talking is really helpful with anxiety and depression, and especially with postpartum depression. I remember with my first baby just being so excited for my husband to come home because it was another person that could talk to me.
And also that's why talk therapy, I think, can be helpful as well. If the person is able to do that. I've certainly had many newborns in my office through the years, and I hope most therapists would be fine with that. I certainly am.
Yeah.
And it's really nice for the client to be able to bring the baby in and talk about it and talk about how hard it is.
And one of the things that I think could be helpful too is validating emotions. It just feels good. And I've talked to other friends who've had anxiety and depression, or who have a spouse that has anxiety and depression, and just having their emotions validated is really helpful.
Yeah. So one other resource, postpartumdepression.org has a whole section labeled support with different categories of advice for, if you are the partner, if you are the parents of someone experiencing this, if you are the coworkers or the friends or the other children. So, guidance for different groups of people wanting to offer support, because definitely that validation and talking to someone, joining a support group, especially online.
Yeah.
There are so many support groups for men, for non-birthing mothers, for birthing mothers, for adoptive parents. Finding people you can connect and relate to and share these stories with is really helpful.
I think we're both real advocates for group therapy, because the research is pretty clear that, when you're in a group with people who are experiencing, the same things, that is so helpful. Because part of it is you think, oh, I'm the only one who's experiencing this. I'm the only one who's thinking this about my baby. And once you find out that you're not the only one, that is incredibly helpful.
Mm-hmm.
Yeah, I totally agree. I've done group therapy before, and they kind of become your clan. And again, I think it's that feeling of knowing you're not alone. There are other people who are going through this, and that's something that I can't emphasize enough on this podcast, is that, and in particular this episode, you are not the only mother going through this. You're not the only partner going through this. It's real. It does not need to be mitigated. You don't need to mitigate to yourself that you're struggling. It's okay that you're not okay, and reach out, no matter who it is, no matter how often or how you go about it. Just find someone to talk to, find some way to reach out to anyone.
Mm-hmm. Yeah. There's been a proliferation of online counseling options.
Yeah.
Even places you can contact by text. The research shows that counseling, talk therapy, is as effective for treating this as medication is.
Yeah.
And so often parents will interface with the medical system. They've trained pediatricians to screen for postpartum depression, because
yes,
that's the group of providers most likely to come into contact with these parents.
Yeah. At my third baby, he's about 18 months old. And that was a new thing that I know Utah had implemented, is I think for the first 6 months at every checkup, they would have me fill out the postpartum depression survey. They would, they would have me fill that out and ask, how are you doing?
Yeah.
Which is, I think it's great, because again, with your OBGYN and your midwife, your doula, I mean, oftentimes you don't see them again for 6 weeks, and then you don't see them again unless you need to. And well, what's going on then? How are things going? So I think that's great that they're starting to do that.
Yeah. Yeah. And there are certainly some changes in healthcare systems that I think can really help with this. For example, I had both my babies in San Francisco, and one of the things they've implemented through the hospitals there are what they call centering groups, these prenatal groups where you just happen to be grouped with other people with similar due dates, and you come and get your prenatal care together.
Oh, okay.
Think of all those things you have to do: get your blood pressure taken, get your levels checked. Doing those as group appointments facilitated by a midwife created this opportunity for parents to form social bonds with other parents, especially in a city where most people do not live near their extended family.
Yeah.
And so it created this little group where then all the babies would be born within about a month of each other. And you could sort of follow each other. These groups tended to stick together as a support cohort.
Yeah.
And, expanding that model would really help. I think we do have to consider this, like so many mental health issues, as a cultural problem that we need to address collectively, not just as an individual problem. And yes, it's important for parents to seek help. And yes, medication and counseling can both be very effective treatments. However, there is a component of when we treat the individual without acknowledging that this is a cultural issue of leaving parents without support.
Yeah.
Especially the issue of parental leave and partner leave.
Yeah.
And when you're trying to, yeah.
Yeah. Well, I think we need more partner leave or spousal leave, because you need all the support you can get in those first few weeks. You're establishing so much. You're establishing a bond with the baby. You're establishing a new routine. You're establishing an entirely new lifestyle when you introduce a new baby into your family. And I think we need to have more advocacy for
that it's a
partner
public
leave.
health issue.
It is. I agree.
Yeah. Healthy moms make for healthier babies, and we certainly know that. So let's take a minute to talk about medication in terms of postpartum depression, because postpartum depression often is a hormonal imbalance. And so in this podcast, we talk a lot about natural methods for coping with anxiety and depression. So let's take a minute and talk about, when do you guys feel, and that's okay if your professional opinions differ, when you feel is the time to say, okay, let's introduce some medication to help you with this?
For me, it's when it becomes so serious that you can't get out of bed and you actually can't function well as a parent, as a new parent. And so I think, neither of us are medical doctors. And so you really have to do a consultation either with, I would probably, isn't an OBGYN probably a better option than even an internist, do you think? And so, talk to your doctor about what are the options. And certainly if you're nursing, I think that complicates it. And I'm not up at all on, do those medications pass through into the milk and what's the effect on the child? So there are a lot of things to consider with medication. But I think sometimes if you're having trouble functioning at a very basic level, then you probably ought to look at all options, is what I would say. What do you think, Adryon?
Sure, yeah. So what I'm familiar with is that SSRIs, selective serotonin reuptake inhibitors, which address both anxiety and depression, are the most commonly prescribed medications for postpartum depression. And that they, have been found to pass through at very low levels into breast milk.
Okay.
And so they're often considered to be safe for nursing mothers and prescribed, but you should always talk to your doctor about the fact that you're breastfeeding.
Right.
The American Association of Pediatrics takes a little more conservative approach and considers them medications that we don't quite know. Like, we don't have enough data about the impact on infants. And so, maybe a little more cautious stance there. When I think is the right time for medication, I mean, definitely what Mark said, that if there's serious functional impairment, inability to get out of bed, is serious suicidality or thoughts of harming your baby, those are good indicators. Another one really has to do with the parent's preference. Often if you're in a doctor's office, which is typically when this is going to be diagnosed, they will almost always offer medication. Hopefully they will also talk about counseling and the fact that counseling is as effective and that it is your choice. Some parents feel like it will be easier just to take a pill.
Time. They don't have time for counseling, or maybe they don't want to make themselves that emotionally vulnerable. But I am a huge advocate of going to the counselor or going to see a counselor in therapy, talk therapy. It should be just as natural as being prescribed a medication.
Right. And then other parents don't really have a resistance to medication, and they may not want to deal with the side effects that certainly occur. And so it's important for them to know that there are other options out there.
Yeah.
Online support, talk therapy by video, talk therapy in person, that there are ways to access help.
Yeah. So one of the things that Dr. Mark Burton and I have talked about before, and that I want to bring up, is if you decide you want to go off the medications, one of the things that he counseled is you have to go through your doctor, and you cannot try to do it yourself. So if you guys wouldn't mind touching on that.
Well, some of the medication, it's different with every medication, but some of them can be quite hard to come off of with some serious side effects. So I think you always have to consult with a doctor and get a plan. And hopefully the doctor would help you plan how you get it off the medication.
Don't go cold turkey.
No, I think that is not a good idea for anyone to do.
Yeah.
Before we're done, though, can I just mention a couple of things? Last week we talked about, in general, anxiety and depression, and we mentioned, certainly we talked talk therapy, medication. We also talked about, I called it exercise. I'm not going to call it exercise at this point. I would call it moving your body.
Yes.
So, and again, I realize it's probably, if you're so tired and you don't have a lot of support, it's probably the last thing you're thinking of. But for your support group, if you can say to them, help me just move a little bit, and maybe it's walking outside, down the block and back up. Any type of movement, I think, is really helpful.
A hobby would be considered moving too. I think hobbies could be a really great thing for depression because you're creating something, and creative outlets are often very therapeutic for people who feel depressed.
Right. And I think I would throw that into the next category almost as some sort of meditative practice. Okay, you remember we talked about that last week as well. I think a lot of hobbies can be meditative.
Okay,
And, we talked about all the different ways the things we do can be considered meditative.
Yeah.
So remember those things. Move your body. Certainly get the sleep, but that's kind of the big problem.
Yeah.
And some sort of meditative practice. And as we said last week, there's such a wide range of what that even encompasses. And you have to find what works for you. You have to do some homework on this. Like if you're going to listen to some guided imagery, you've got to find a voice that you like, content that you like. So, or breathing exercises. There's so many things you could do. I think the important thing is to do something.
Yeah, do anything that feels good to you. We also talked last week about self-care, and self-care is never more important than when you are a new mom. And I think it's also important to acknowledge that it's good and it's healthy for both mom and baby to spend some time apart. And that can be really hard for new moms to physically not be with their baby, but it's good. And you need that. You need time away from your baby.
And so, since we've looped back around to sleep, which is such a huge issue with mood issues, that reminding yourself there's a light at the end of the tunnel, that this feels like it will last forever. All babies certainly start to sleep through the night at different times. If you're a parent who has a child who doesn't sleep well, like I feel you.
Been there.
And for the most part, between 6 and 12 months, it is going to get better. You are going to get a lot of sleep. And so, for a lot of people, they find after about a year, they start to feel like themselves again. That they start to feel joy again and interest in the things. And this, I'm talking right now about people who don't meet criteria for full depression, that the average experience of most parents is that first year is an intense time. It is not a very happy time because you're not well rested and you don't feel like yourself, but you will. That you will get your cognitive functioning back. You will get your personality back. Your zest for life will come back.
That's what I tell my new parents as well, a year. And I think it's a bit shocking when they hear it, but I think it's better that they go into it knowing that's what it's going to be. And I agree.
Yeah.
When you're in the middle of the depression and the anxiety, it feels like it's never going to get better. And this is the way my life is going to be forever. And it's just, that's not the case. That's one of the things I think talk therapy can really help with is you get kind of a reality check saying, yes, this is how you feel now. It won't be how you feel in 2 months or 4 months.
It's hard right now, but it will get better. Like you said, light at the end of the tunnel. So thank you guys so much for doing this. Next week, we are going to talk about PTSD. So be sure to tune in. And also, if you have questions or scenarios that you would like Dr. Mark Burton to talk about, you can now email us. Our email is mentalhealthpod21@gmail.com. I will have that linked in our show notes. Thanks so much for joining us, everyone, and we will see you next week.